Hi, Dr. Turovsky here. I would like to talk to you about the facial rejuvenation. It is a very broad topic, and as you can imagine, there are different ways to do it. There are different philosophies. Every surgeon has their own experiences and their own ideas of what works, what doesn't, and how to approach the aging phase. My goal is to make you look better and not necessarily weird. And that's my approach to the facial rejuvenation. A lot of people are afraid that they're going to look funny, they're going to look actually different and worse than they did before. And to tell you the truth, I agree. I mean, I'd rather be old than looking weird or funny. So my goal is to make you look as good as possible without looking artificial. So let me tell you what my approach is. We are going to divide it into two different approaches. First, there is a group of patients that are associated with the early aging. And we are talking about the 30 years old, 35 years old, 40 years old women, usually women, although men are becoming more and more interested in early facial rejuvenation. Of course, the non-invasive approach is very popular. I do a lot of fillers, a lot of Botoxes, and a lot of non-invasive treatments. However, to tell you the truth, if somebody is looking into the most natural look, early intervention with the surgery becomes again more and more popular. And what can I offer for this early rejuvenation? First thing that goes down or is distorted is the cheek area and the brow area. So for a lot of these younger women in their late 30s or early 40s, I think there is a very interesting approach to rejuvenate them with repositioning of these areas. So for the brow and eyelid area, the endoscopic brow lift is the way to go. A lot of surgeons claim that this is not a good procedure and it doesn't give you good result. In my experience, I've been performing this procedure for over 20 years and the results are actually usually fantastic and they are lasting. If you go to my webpage, you can see the pictures of women that I operated on 15, 20 years ago and they still have a lasting result of brow lifting. Endoscopic brow lifting has an advantage over the open brow lifting that the scars are minimal and the recovery is minimal and there is really no worry about the visibility of this procedure. It is done with the help of the endoscope, which is a small camera which allows me to protect the nerves and protect the vital structures. Without it, that would be much more dangerous. So it is a great procedure. Please read about it on my webpage and you can find that it's actually great for any ages, but starting in a very early age of 30-something years old. And here I actually have to add that the procedure can be also performed as a beautification procedure in a 20-year-old or something because they may be not liking the sleepy appearance and low position brows. But there is another procedure that is very good. It's called a mid-facelift or a cheek lift. This is something that repositions the soft tissues of the face back into the upper facial area. And that occurs very early. That occurs either in their 30s, but of course progresses as we age more. The mid-facelift procedure is actually helpful for a lot of ages. What is good about it, that it actually is the most natural result. The fillers can give you a feeling of the face and sometimes can mask the early aging, but they're not going to change the shape of the face in the way that mid-facelift does, because mid-facelift actually reduces the bottom of the face and puts everything up where it belongs. So from the face that started like this, and when it's aging, it goes like that, we're creating again the triangular face. So this is something that is not possible with anything else. And the nice part about it is that as long as it's performed with just as a separate procedure with maybe endoscopic brow lift or mid-facelift, there are no scars. You can still wear your ponytail, you can still do everything and nobody knows even that you had the procedure done. So I do it sometimes for The very young people. There are women who are 20 years old and they have so-called baby faces, and they are squarish, they are not chiseled out look. The mid-face can help them, maybe with a combination of the removal of the buccal fat pad, which is a fat located in the middle of the face, right here. So when you combine these procedures, you can actually not only rejuvenate the faces, but make them look beautiful at the earlier age. So this is for the younger crowd. Now as you age more, we also have a loose skin, and the skin it usually means neck, loose neck and hanging neck. So we come to the category of patients that are already late 40s, 50s, 60s that usually would benefit from the combination surgeries. And here is a word of caution. A lot of people are actually scared about the multiple procedures because they said, oh, I just want a little something. I don't want a big procedure, I don't want a big change. I can tell you that if you combine little procedures, you will look better than with one big procedures, because really what happens to the face, it ages here, 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 and here. So if you try to lift everything with one approach, you will never get the same result as if you approach it together. So the best results and the most natural results are actually coming from the combined procedures. So to me, if you want to look the best, you should do that. You should combine the procedure. Of course, there is financial problem. They're becoming more expensive and lengthy. So for somebody who is concerned about it and cannot afford it or don't want to afford it, we can trim it. We can combine the different approaches. But let me tell you about the total approach, which is usually works the best. And if you want to look not only younger, but prettier and back to where you were before, this is the best approach. So if you look at the face, it's like looking at the aging house. You can approach the roof, windows, and the doors and the paint, and that will look the best. You're not going to look the best with just the windows changed. So going back to the face, when you look from the top, first thing to go is the brows. Brows go down. And for some patients, maybe not necessary, but for most, especially women, I rarely do this procedure in men because they look feminizing, they look more like a woman, so it's usually not a good idea. But for women, this procedure is the best because it actually makes them look pretty, and every woman looks good with the brows in the higher, but again, not higher like this, but higher like that position. That avoids the look of the deer in the headlights. Everybody's afraid of that they will look funny, they will look like this. That's not good. That's not what we do. We are going to reposition your brows in a position like this, not like that. So that if you look at my pictures in our website, you'll see that people are looking younger, but not necessarily scared or looking like they again deer in the headlights. Next thing that ages is the eyelids, and the eyelids usually become either loose, so you have a overhanging skin, and women hate this exceptionally because they have a problem with the makeup. The makeup doesn't stick or move, so that's sometimes the only reason they come to have it corrected. And it's also combined with some extra fat. So usually blepharoplasty or eyelid lift means that we remove some fat, remove some skin, and the eyes are more open. For the lower eyelids, this is usually associated with the bags. There are so-called bags that form under the eye in the lower eyelids that are really just the herniation. It's a hernia of fat that pushes out, and you create a bag that forms a shadow. So this makes you look tired, makes you look older. And again, this may be aging, or this may be associated with just the way you look. But with aging, we correct that. The way I do it is to avoid the complications, which are quite significant in the lower eyelids if it's not done right. I approach it from the inside and outside, and actually you have a combination of two procedures, inside and outside. And by combining these two approaches, the chances of having a real problem are minimal. I do it for 20 years. I never had a patient with ectropion. This is the really scary surgery. If it's not done right, you can have a real problem. So make sure that you do your research and make sure that you do it right, or find somebody who does it right. Going down, mid-face, or I already talked about it before for younger patients, but for older patients it's even more important, because cheeks go down and then form a bulk of soft tissue here instead of here. Now you can try to fix it with the fillers, but if you can imagine, you already have too much here and you have a hanging tissue here, you want it back here and removed from here. Fillers will not do that. Mid-faces will do, and mid-face is done in my practice from incision in the scalp and incision inside the mouth, so no scars outside of the mouth or hair, and that actually changes the face. Again, go to my webpage, look at the pictures, and then you see what I have in mind. You actually can reshape the face instead of doing shape changes, like fillers. That will not rejuvenate you. That will just change your shape. It may help, but not the same way as the filler. For some patients, it actually is worse. So for the full faces, don't even try to do fillers, because it will not help you. People will try to sell it to you because that's what they do, and they're not surgeons usually, but that will not help you. So make sure that you are evaluated by the person who can offer both approaches, non-surgical and surgical, because I am able to give you the best rather than push fillers on you or push the things that are not working. And then we go down. Now with the age group that we are talking about, we're talking about the neck, and neck is the key. Everybody who wants to look young has to have good neck. And here we have two problems, loose skin and fat and loose muscles. So the best way to approach it is to approach all three of these. First of all, we have to take care of the fat. Fat is in two layers. One is the layer under the skin and the layer under the platysma muscle, which is right in the neck area. In order to get to that, you can do liposuction, but you're only going to get part of that. You're only going to get the fat that is above the muscle. If you want to approach the fat under the muscle, you have to do it under direct vision. You have to make a little cut under your chin, which is pretty much invisible. Go down there, remove that extra fat, and tighten your muscle. Because the bands that form in the neck, they form because of the loose muscle. So unless you approach that directly, you will not fix that. So this is the first part of the procedure. The second part of the procedure is to go around your ear, and the way I do it is from the hair inside the ear and back into the hair. So once it heals, you pretty much can wear the ponytails, you can wear any hairline, hairdo that you actually want. And also allows me to remove extra skin. It's amazing how much skin is in the loose neck. Sometimes we remove that much skin from the face, and it has to happen somewhere, so it happens around the ear. So I pull the ear, we pull the muscle, but the way to do it right is to do zero tension on the skin. The tension is on the muscle layer. It's not the tension is not on the skin, because that's what gives you a pulled look. So surprisingly, at the end of the procedure, the muscle is tightened, the cheeks are lifted, everything is replaced, and then the skin is just positioned. You will still remove a lot of skin, but there's no tension. Your skin, the suture line is without the tension, so there's no pull on the earlobe, there's no pull on the ear itself, and the scars are great because there's no tension. So these are the key elements of facial rejuvenation. Lifting vertically of the cheek and brows, and lifting your skin this way, or removing your excess skin this way. And once you combine this procedure, then you're actually going to look younger and you're going to look better. Again, I'm open to discussion, and there are different variations of all this procedure. I described you the total facial rejuvenation. One thing I didn't talk about it is the wrinkles and the discolorations on the face. That has to be approached with the laser. So sometimes we combine all these procedures with the laser treatment, because that really completes the whole rejuvenation. But again, this all can be modified, and it's always personalized. But if you want to look good at the best, that's the way to do it. So please contact me. For those who are from the distance, please send us the pictures of yourself. I can discuss your situation over the phone, over the internet, over Skype, or obviously come for a consultation in our office, and that's the best, but again, we have a lot of patients coming from a distance. We can pretty much discuss everything over the phone, over the internet, give you an estimate so you know exactly what to expect, and then you just come back for surgery. For those coming for a distance, depending on type of the surgery we choose, you have to be a week or 2 weeks here, depending on extent of the surgery that we do. But generally within 2 weeks you'll be able to go back to your home.